Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to my YouTube channel, Science for Everyone. Today I will discuss a very important topic with you people. And the name of the topic is progeria. And in this topic, I will discuss that what really progeria is and what is the real cause of progeria. Okay. And after watching this video, you will get your answers to all your questions. Okay. I think just look to this picture. I think most of you people have seen this type of child on the internet and on the Google and on YouTube. Okay, and this is a type of syndrome. Okay, it's a type of syndrome, and the name of that syndrome is known as progeria. Okay, so this is not a healthy person. Okay, and he looks very much old, rather his age is about 5 to 6 years old. Okay, but he looks like that he is of 20 or 30 or 40 years old. Okay, so this really was this is called progeria. Okay, so I will discuss every aspect of progeria, that what happened to the what happens inside these children, that they age faster. Okay, and they look older. So let's start with the topic. I will explain this in my own way. First of all, I will give you a background so that your mind are set, and after that, then I will start with the definition and with the later on explanation. Okay. So let's start with the video. I want to tell you that our skeleton, we are having our skeleton, okay, in our body. And what does this skeleton do? It provides a structural support to our body, okay. And what if we don't have bones or skeleton? So just look to this picture. अगर हमारे अंदर skeleton नहीं होगा, तो then we will just look like a jelly type, okay, because this skeleton, this bones gives us support. Okay, I'm just giving you the importance of support, a supporting structure. Okay, that in the universe everything have a support. Okay, so a person, a human body have a structural support, and the support is of the skeleton. Okay, without skeleton we will just like we will look like a jelly type. Okay, so I'm just giving you the importance of support. Looking to the cells have a cell wall covering. The plant cell have a cell wall. Even the bacterial cell and the microorganisms have cell wall. Our animal cell have cell membrane. They give the cell a support. Okay, so this is also a type of support. The cell wall give the cell as a special support, and give them as and give them a special shape. Okay, and that shape is because of the cell wall and the cell membrane. Okay, so these are also structural supports. I am just giving you the background that when I'm entering the progeria, the explanation of progeria. So first I'm showing you that what is the importance of support to our living or to the living organisms. Okay, just look to the tire. For example, if there is a tire and it has a rim, this is a rim. Okay, so if a tire is having a rim, so it can support larger loads. Okay, it can carry out larger loads. You have seen that every if there is a tire inserted in a vehicle, so it must have a rim. Okay, and this is a tire without a rim. So if a tire is having a rim, so it is it can bear large loads. Okay, and if a tire is not having a rim, so with small load, it can squeeze. Okay, it can deform, it can change its shape. Okay, and just because of this rim, it is having support. So now look to the nucleus of our body, of our cell. Okay, our nucleus have also is also having a support. So, and this support is known as the lamina. Okay, this is the lamina. If I want to show you in the basically it is the color is in blue form. Okay, so this is the lamina. I want to show you, this is the lamina, and just because of this lamina, These are proteins, okay, and these proteins give the nucleus support. Without this protein, without this lamina, this protein, the nucleus of the cell will squeeze and will the shape of its it will be disrupted, okay. So this lamina, these laminar proteins gives a special structural support to the nucleus of our cell, okay. Our cell is supported by cell wall and cell membrane, and the nucleus is supported by it is also supported by the nuclear membrane, but the nuclear membrane is internally supported, and the whole nucleus is internally supported by these blue color protein, and this is known as laminar proteins, okay. Just look here, this green, this is also known as lamina, okay. So this gives support to the nucleus, and without when it is not present, okay. So if it is not present, so the nucleus cannot bear any load, and the shape of the nucleus will be disrupted, okay. So and most of the vital activities will be cannot be performed inside the nucleus. So this is a support of a nucleus, okay. So I was just giving this is also a picture of nucleus, and this cage like structure is the nuclear lamina, okay. This gives a special support to the nucleus, okay, and without its support, the nucleus cannot bear any load, and it can be squeezed by the internal pressure of the cell, okay. So this is very much important for the nucleus. So this was, I was just giving you the importance of support in our life, okay. I give you the skeleton that it gives us support. I show you the cell wall and the cell membrane, it gives support to the cell. I show you the definition, the support of a tire. If it is not having a rim, it can be squeezed with the load. And then at the last, I give you the importance of the nuclear lamina, that without a nuclear lamina, the nucleus cannot support pressure, okay. It cannot withstand pressure, the internal pressure of the cell, and it can be, the shape of the nucleus can be disrupted, okay. So just keep this thing, this supports in your mind. This will help you in the further lecture, okay. Now come to the progeria, the definition of progeria. What really progeria is? The word comes from a Greek word. Pro means before or premature, and geras means old age, okay. Basically, progeria is a syndrome in which a person age faster, okay. If he is 5 year old, he will just look like a 30-year-old man, okay. The skin will be not that soft, just like as the baby have, okay. So this syndrome is known as progeria, and why it happens, I will now show you. It is a very rare genetic disorder that causes a child baby to age faster. I told you that it causes a child baby to age faster than normal, okay. So if it is he is 5 year old, he will just look like an 30-year-old man, okay. The skin will be just like the adult skin, okay. Affects in a single individual in about 4 million of population. I told you that it is a very rare genetic disorder. Genetic disorder means that it can pass from there is a mutation inside the DNA of that individual, okay. And I want to tell you that it can pass from mother and father to their child, okay. So it is a genetic disorder in which the child baby it causes a child baby to age faster, and it is very much rare. About there is a single case in 4 million of population, okay. Just coming to the history, so this progeria was discovered by Hutchinson Guilford Progeria syndrome. It is known as Hutchinson Guilford Progeria syndrome because it was discovered by Dr. Jonathan Hutchinson and Dr. Hastings Guilford. Okay, these two scientists, these doctors, discovered this syndrome, the real cause of this syndrome. Okay, now here come the cause, that what really happens inside our that individual's body, that they show these type of symptoms. Okay, so progeria is caused by a mutation. Okay, I told you that it is a genetic disorder. So it is caused by a mutation that weakens the structure of the cell nucleus, making normal cell division difficult. Okay, it is a type of there is a mutation inside the DNA. What type of mutation is, I will tell you in the later video. Okay, but there is a mutation, and just because of that mutation, it affects the cell nucleus, the structure of the cell nucleus, and it weakens it, and makes the cell division difficult, because we know that in the cell division the nucleus also divide. After that, other organelles divide and the cell divides. So the division of the nucleus is very much important. Okay, so if the structure of the nucleus is very much weak, so how can it be divided? Okay, so just keep this thing in mind. First, we consider a normal person. Okay, I will show you that what really happens inside a normal person, and then we will compare the that this condition with the progeria progeria person. Okay, that the person having progeria. Just look here, this is a very much important slide. You can use it, and I have made it in my own way, and in a very simple way. I will show you that. I will explain it now. Okay, that what happened really inside a normal person. Here is a gene that is present in our DNA, and that gene is known as LMNA gene. Okay, LMNA gene. This is a type of gene, and when it is transcribed and translated, so a special proteins are produced that are known as pre-lemon A proteins. Okay, pre-lemon A protein. Why this is called pre-lemon A protein? Because they are not now in the specific condition to perform activity. Okay, so that's why we call it pre-lemon A. Okay, so these proteins are produced. After that, what happens? So after that, these proteins should be modified by different activities to make them functional. So what happened? These lemon A genes are transcribed and translated, and after that, pre-lemon A proteins are produced, and it is happening inside the cell. Okay, so after that, a special farnesyl group. Farnesyl group is a special functional group that is added to the pre-lemon A proteins. Okay, and it is done with the help of enzyme farnesyl transferase enzyme. Okay, here is an enzyme. It acts on the it helps in attaching this farnesyl group with the pre-lemon A proteins. Okay, after that, when it is attached to the protein, this black color is the farnesyl group. Okay, for example, this is the farnesyl group, and this is attached with the pre-lemon A protein. After that, here are it migrated inside the nucleus. Okay, through nuclear pores. Okay, there are nuclear pores in our nucleus. Okay, so by using these nuclear pores, these farnesylated pre-lemon A protein enters the nucleus of the cell. Okay, after that, what happens? Protease enzymes. Okay, protease enzyme also migrated inside the nucleus. Okay, just keep these steps in mind. First, what happened? The lemon A genes is transcribed and then translated. After that, pre-lemon A proteins are produced. After that, what happens? Farnesyl transferase enzyme add farnesyl group with the pre-lemon A proteins. Okay, and after that, it is migrated inside the cell. It is transferred inside the cell with the help inside the nucleus with the help of nuclear pores. Okay, it enters through the nuclear pores, and the protease enzyme also enters the nuclear pores. Okay, inside the nucleus. What is its function? Now I will give you the detail. Okay, after that, what happens? Protease cleaves the complex. Okay, this is a complex, and this complex is known as farnesylated pre-lemon A proteins. Okay, so what happens? These proteins are these complexes cleaved by this protease enzyme, and after cleaving it, what happens? They cleave the complex in such a way that it cut the pre-lemon A protein in such a way that it removes the unwanted part of that pre-lemon A protein, and it produces a active protein that is known as lemon A protein. Okay, Now the lemon A protein is now functional for us. Okay. First, the pre-lemon A cannot perform its function. It should be modified. So it is modified. The first modification step is that farnesyl group attach with it. After that, it enters the nucleus. Inside the nucleus, it is cleaved by the protease in such a way that the unwanted or the unfunctional part of that pre-lemon protein is removed and the functional part is produced. Okay. Now what happened? These lemon A proteins are deposited on the nuclear lamina. Okay. These are the proteins that add that give structural support to the nucleus. Okay. And this is basically the lemon. This is the nuclear lamina of the nucleus. And just because of these protein give the nucleus a structure support. Okay. Without these proteins, the nucleus cannot be supported by anything else. Okay. So this protein gives the actual support to the the nucleus. Okay. And the nuclear, if someone asks you that what is basically inside, what is the proteins that are present inside a nuclear lamina. Okay. So you will tell them that it is lemon A protein. Because of the lemon A proteins, the nucleus is supported. Okay. So millions and billions of new proteins are produced and it gives support to the nuclear lamina. So I have just shown you three proteins. Okay. Just look here. If it is pre-lemon A, so it can barely attach to this cell wall and this nuclear wall. Okay. And when it is cleaved to lemon A, then it can easily attach to this. Okay. So this is the lamina and it is happening inside a normal person. Okay. I was just showing you that what is happening inside a normal person cell. After that, now I will show you that person with Progeria syndrome, what happens inside it. Okay. Now here come the if a individual is experiencing a Progeria syndrome, so what happens inside inside its cell? First of all, I told you that it is just because of a mutation. That is, and so the lemon A gene is mutated. Just look here. Here is a point mutation. Okay, just because of a point mutation, the lemon A gene is mutated. Okay, so as we know that if a gene is mutated, so it produces abnormal proteins. Okay. So these genes is transcribed and translated and pre-lemon A proteins are produced. But here the pre-lemon A proteins are these are abnormal proteins. Okay. Not perfect protein, just like the pre-lemon A protein present inside a healthy individual. Okay. Because why these abnormal proteins are produced? Just because of these mutations. Okay. After that, that normal person is that the farnesyl transferase adds farnesyl groups to this abnormal pre-lemon A protein. Okay. And it enters inside the cell, inside the nucleus, and these proteins also enter inside the nucleus. Okay. After that, what really happens here? This is the main step. Okay. This is the main step. Just because of the abnormal structure of this protein, the protease cannot cleave the complex. Okay. In the healthy individual, okay, the protease cleave this complex. Okay. And after that it produces functional lemon A protein. But here the protease cannot cleave this complex, and this is just because the pre-lemon A proteins are in the abnormal form. They are not in the perfect condition. So as we know that it cannot cleave this complex, so this complex remains as the same. Okay. So now you so just because of this structure, it cannot be deposited on the nucleus wall. Okay. The wall of the nucleus, so it cannot add in the structure support. First, when it was in a normal condition, so it attaches it deposits in the on the cell on the nuclear wall. Okay. But here it cannot deposit because its structure is not that functional. It is not that functional. So just because of this mutation, and just because of this mutation, the abnormal proteins are produced, and after that it cannot be cleaved by the protease enzyme, and just because of it cannot be cleaved, so it cannot attach to the nuclear wall. Okay, and if it is not attached to the nuclear wall, so the nuclear wall will become weaker and weaker, just because the lamin A proteins are not deposited, and just because of the it is not deposited, the nuclear wall is becoming weaker and weaker, and the support is it cannot then bear loads and the internal pressure of the cell, and just because of it, the structure of the nucleus is disrupted, and after that it cannot perform cell division. Okay, so a normal cell division cannot be performed, and just because of it, the progeria syndrome develops. Okay, so now I will tell you. So just because of these, this is a normal cell, the lamin A proteins are deposited, and the structure support is very much rigid, and the cell can divide. But in the progeria syndrome, the nucleus is very much weaker, and its shape is disrupted, and because of the internal pressure of the inside the cell, the nucleus can be damaged, and the structure of the nucleus can be disrupted. And when the nucleus is disrupted, the structure of the nucleus is disrupted, so it contains the DNA, and if that DNA is exposed to the cytoplasm, so it can be denatured. Okay, and the cell is killed. Okay, so just because of this, the progeria syndromes develop. Okay, so a person cannot perform active cell division, and just because of that active cell, the lack of active cell division, the rate of cell death exceed from the cell renewal. Okay, and just because of its he age faster than normal. Okay, so this is the main cause of it. What are the symptoms? So most kids with progeria look healthy when they are born, but they start to show signs of the disease during their first year. Babies with progeria do not grow or gain weight normally, and just because of the cell division, there is no active cell division, so how can they grow? Okay, this is the picture of the progeria syndrome. Just look here. I think he is, I have studied, he's 5 to 6 years old, but look to his structure of the face and the skin. It is just like an old man, looking just like an old man. And there are many other symptoms now I will discuss. Okay, this is a person, this I think this is 13 years old, this or I think 9 years old, and just look to her face, just these wrinkles in the skin of this person. Just look here, just like an old lady, and this is just because that the cells are not actively dividing inside the body. Okay, the cells are not actively dividing, so just because of it, they are witnessing this symptom. Other symptoms are bigger head. Okay, the person will have a bigger head, large eyes, smaller lower jaw, a thin nose, ears with stick out. Okay, large ears, veins can be seen. Okay, slow and abnormal tooth growth. The teeth cannot be grown quickly. A high pitched voice. Okay, the voice will be a very high pitch, just that can we can say that it can annoy the people. Loss of body fat and muscles. Okay, the person will be very much thin, and hair loss, including eyelashes and eyebrows. Just look here, he will having a bigger head, and the hair, just look to the hair loss. Okay, and just look to the body structure, and the ears are very much bigger. Just look here, the eyes, and here look the teeth, they are not in a good condition. Look to the eyebrows and the skin. So these all are the symptoms of the progeria syndrome. Here look, just look to the chin, the lower jaw, it is all very much thin. Okay, very much inside of the, as I show you here, a thin or a smaller lower jaw. Okay, the lower jaw is very much smaller, and I told you that the veins can be seen. Okay, so here just look to the veins, it can be seen. So these are all the symptoms of the progeria, and this is just because that the cells are not actively dividing. Okay, what is the treatment? So there is not an active and real treatment of this progeria syndrome. Okay, and a person can live up to 13 years. After there is no person that have exceed this limit. Okay, I think there was a person who have exceed 15 years. At this time, there is no cure for progeria, but researchers are working on finding one. A kind of cancer drug, farnesyltransferase inhibitor, may fix the damaged cell. Okay, and treatment usually help ease or delay some of the disease symptoms. How this drug work? In my view, farnesyltransferase, just look here, I want to show you. If we eat farnesyltransferase, okay, these drugs that are farnesyltransferase inhibitor, so this farnesyl group cannot be attached to the to these proteins, and after that when it enters the nucleus, so these protease cannot it cannot cleave, it will not cleave that complex. Okay, because there is no such complex, because the farnesyl transferase inhibitors have inhibit the farnesyl group to attach to this protein. After that, if there is no farnesyl group present on the prelamin A, so there is a little bit chance that these proteins can bind. These proteins can bind with the cell with the nuclear wall of the nucleus. Okay, so this is just a theory, but it might bind with the nuclear lamina, okay, the nuclear wall, but it cannot bind that much effectively, just like the active lamin A protein, but it might bind. Okay, so this is just a theory, and it is working. Okay, working studies and research is conducting over this progeria syndrome, and in the future I think so there will be some uh, real real treatment for this syndrome. Okay, so this was all about progeria. I think you have now get the real idea of progeria, and the main idea, the real cause is that the cells are not actively dividing, and it is the cells are the cell death is exceeding the cell renewal, the cell division. Okay, so just because of this, these symptoms are produced. Okay, so hope you have understand it. If you have any question, you can ask me in the comment box. I will also answer you there. Thank you very much. God bless you.